One of the things I enjoy so much about being an advanced bioidentical hormone therapy provider, with males when it comes to testosterone deficiencies or suboptimal levels, let's just say, or what we call secondary hypogonadism, particularly medical term that you can maybe charge insurance for, is that there are different options and there are different modalities to be able to work with improving your testosterone deficiency. So first of all, let's just talk about the normal things that we would all think about when it comes to testosterone deficiency. It could be decreased sexual pleasure. It could be erectile dysfunction. It could be, a lack of performance and ability to have good exercise capacity in terms of endurance, and or building on and adding to your lean muscle mass structure. It can look like poor sleep. It can look like fatigue, obviously. It can look like actually low red blood cell counts. If you ever have done a lab slip and seen anemia pop up on what we call your CBC. It can also look like a decreased size in your testicular volume too. So just a few things to think about if you're kind of trying to clue in, is this me? As we talk about testosterone therapy in males, reference ranges depend on a little bit of who you were in your athletic pedigree and your high school and your college years. A pro NFL player is probably going to have a higher hormonal aptitude and appetite and utilization rate than somebody who was a wrestler throughout college. Very much both active males, right? But they're gonna just have different degrees. So when we're coming in, we're assessing levels on a male physiology. We use in LabCorp reference ranges, we're looking for a total testosterone and then a free testosterone. If you're not familiar with the difference between the two, total testosterone is what's available to be used. It's bound up to a protein called sex hormone binding globulin, a little vehicle carrier that is distributing your testosterone in the bloodbath through to your organs, and it's available to be used upon demand, which is then called free testosterone. And free testosterone is what's actually giving you all the work. So the improved erectile health, the ability to have strong muscles, bones, cardiovascular, performance and things. So when we look at those two numbers, some of the reference ranges will vary based on who you were previously and what your demands are today. And so not every reference range is going to be standard for and among men. And what I will say, generally speaking, when we're looking for physical optimization, a little bit of maybe super physiological tweaking, I'd like to see men in somewhere, at least in a total testosterone level, 900 kind of as a minimum, to somewhere 1200, 1500 perhaps. And then on the free testosterone, definitely somewhere between 25 and 40. I'm not mentioning reference units, I apologize, but that's what I'm looking for when we're trying to optimize you into testosterone wellness and therapy. Now, let's see if we want to talk about this. You can technically certify for a diagnosis of hypogonadism, meaning low testosterone because of malperformance of testicular production. If you have a total testosterone, so the top number, not the free, of 300 or less, and that will be insurance approved to get you on commercially available testosterone therapy like injections once a week. Now, you have to draw that lab twice early in the morning, because in male physiology, you guys wake up ready with the peak of testosterone. That's why there's erectile function early in the morning. Women kind of wish they had that. We're more of a slow burn, and our testosterone kind of comes in a little bit later in the morning hours than it does for men, especially. So anyways, you want to capture your testosterone level early in the morning, then somewhere between an 8 a.m. and 10 a.m. window to make that accurate, because we want to know what is your peak. So if we measure and capture less than 300 on the total testosterone on 2 separate blood samples in the 8 to 10 a.m. window physiologically, then we will diagnose you with something that ICD-10 code, billing and insurance will approve you for testosterone therapy. However, if you're anything 300 or greater, even if you're 301, that's not going to qualify you for that. And yet, we know if you're living at 350, it's probably not where you're feeling full tank, fueled up, ready to live life, large and in charge. So when it comes to testosterone therapy, I want to use that word testosterone therapy in the sense of how are we going to optimize your testosterone, but there are other options depending on your age, your comorbidities, other health influences that you have going on, cost, to be frank, on things, and then goals of care. So not every male that walks into a Kayla West office will get placed or will be placed on testosterone creams or injections. There are other things available, something called HCG. You may or may not be familiar with that. That's also an injection. Um, there's also something called Clomid or enclophamine, another form of it. That's an oral pill that works in a different way to boost your testosterone's availability. There are also supplements out there, Tonga LE, boron, things of that nature that can help just naturally give your production of testosterone a leg up if you're not even interested in the pharmaceutical realm of things. So I thought I'd just introduce those concepts to begin with, and I'd like to talk about each of those a little bit more in depth because it's interesting to know that there are options out there and there are caveats to some of them. Why would we use one and one versus not the other? And then when we get into the actual testosterone therapy, so using a testosterone cream or a testosterone injection, there are different understandings and principles of which they can be applied to men, not one size fits all. And so that's unique, and I think something that men should know going into an appointment, so that we understand that not everybody's going to be on the same regimen of things. So I wanted to introduce a little bit about testosterone therapy to males because I have not spoken about males very much yet on this platform here. And in the next few videos, I'm going to talk about some of the applications of the pharmaceutical options that we have available through Kayla West and the reasons for their being. So follow along, stay for the next video, and we'll get a little bit more into the nitty-gritty. Thanks for listening.